So this sounds like a two-part question. One, we should not be criminalizing anyone who's suffering from behavioral health disorder, and that is why I work to create the behavioral health crisis response initiative for nonviolent crisis, for these types of crises, so people are not handcuffed because they're experiencing behavioral health crisis or homelessness or mental health crisis, so that a trained worker can intervene, implement whatever tool and resources need to be implemented, but also connect people to services for continued care. Because many people, particularly those of marginalized communities, historically underrepresented groups, rather than get the services that they need, they find themselves in the justice system, and that's something that I want to change. And there needs to be some additional training within public safety. Part of the reason why this program is within public safety is, one, we also need to have a mechanism where someone calls 911. It may be for a police incident, maybe it's for fire, but we also should say this is for a behavioral crisis so that the right people can be directed to intervene again. But again, we need to ensure that, as mayor, I will ensure that that program is expanded and funded so that we can have 24-hour response services, and also implement some training within public safety, whether it's a firefighter, EMS, a police officer. But what this does is frees officers to do their job and address the crime, the real crime, and then someone who is trained to address these situations can go out and do it in an empathetic, but also approach this from a diversity, equity, and inclusion lens. So I will continue to fund the service and expand it within the city of Providence, but also work with our local organizations to ensure that people are connected to services and that they can support the needs of the community as well.